Hi there, it's Maggie from Maggie's Memories. And today I really want to talk about what are some of the common challenges and issues that you might face as you care for your loved one who has dementia. One of the first things that you may come across is denial, especially you'll see this exhibited in not wanting to go to the doctors. They're not going to the doctors. They don't need to go to the doctors. There's nothing wrong with the doctor. He's a quack. I don't need to take all this medicine. There's nothing wrong with me. Unfortunately, this is very, very common, especially in the early stages as we're not ready to accept what's going on, even though we see what is going on. So the not wanting to go to the doctors, one of the things I tend to use as an excuse to see the doctor is Medicare is requiring this annual physical be done for you, or they're going to cancel your benefits. If they're a veteran, I blame it on the VA all the time. Medicare has silly forms and hoops we have to jump through. So by using that route, I found I have good luck, or at least better luck, with getting them to visit the doctor. Another issue you may face is losing important things. They may not admit that they've lost it. They put it away. It's fine. It's just put away. I'll get it out later. When honestly, they have no idea where it is. Also, sometimes at this point, they can start accusing people of stealing it. Someone took it. I had it right here and it's gone. Here's a fearful thought: getting lost. They could get lost in their home, get lost in a moment of time, but unfortunately, they could get lost geographically. It's very important that if your loved one with a dementia diagnosis is still driving, that you have a real conversation with their doctor and with them about it. Also, making sure you have extra copies of their insurance cards, their driver's license, their license plate numbers, an up-to-date photo of their car and of them. I don't want to scare you, but this is a real danger that we have. Today, they may be perfectly fine, can tell you where they live, when they live, they are safe to drive. But unfortunately, that might not be tomorrow. And you have to get your mind prepared for that. Next is unsafe tasks. They're doing their day-to-day things, but now they're doing it unsafe. A couple things come to mind when I think about this. One is cooking. They're leaving burners on. They're leaving the oven on. A towel may be placed on the stove when the stove is still hot. Things are being left plugged in. Coffee pots are running dry. Another unsafe task could be taking their medication. They can identify that's their blood pressure medication. They know that they need to take that to keep their blood pressure under control. They know the bottle says twice a day. They misunderstand what that twice a day means now, and they're taking 2 pills in the morning instead of taking 1 in the morning and 1 in the evening. They may be diabetic and need insulin, and now they cannot understand the sliding scale any longer with their insulin. And just like with driving, today they may be perfectly fine with that medication and can explain it to you and understand it. But unfortunately, tomorrow's a new day. repeated phone calls over and over again. They're calling you. What time are you picking me up? Okay, 2 o'clock. 5 minutes later. You said you were coming to pick me up. Yes, Mom, I said at 2 o'clock. You didn't say 2 o'clock. I'll be there at 2 o'clock, Mom. 5 minutes later. Why aren't you here? Mom, I'm going to be there at 2 o'clock. Well, why didn't you say that to begin with? And then we get another call. Well, I missed my appointment now. No, Mom, your appointment's at 2. I'm going to pick you up at 2. I don't even want to go now. Forget it. This is ridiculous. We can't hold on to that short-term memory anymore. We've hold on to the memory that we're going to the doctors, but the when and the where is getting all confused. And we can't remember that we just called you. We know that you're taking us, but we can't hold on to that information from 5 minutes ago. Refusing anything and everything. As we progress with our dementia, we lose so much of our independence. We lose so much of the control in our life. And sometimes to take it back, the only things that we can take back are what's offered to us. So do I want to go for a drive? No, I don't want to go for a drive with you. Do you want to go out to dinner? No, I don't want to go out to dinner. Do I want to take a shower? No. You want to get your hair cut? No. It has nothing to do with not actually wanting to do it or wanting to join you in that activity. It has to do with wanting to keep some of who we are. Okay. So please don't look at them refusing you as them giving up on life. Kind of rephrase it saying, I'm going to go out to dinner. You're welcome to come if you want to. And kind of leaving it at that and putting the ball in their court. I try to avoid yes and no questions whenever possible. Either ors work much better. Okay? Bad mouthing. You are going to get bad mouthed all over town. I've been accused of poisoning. I've been accused of stealing their husband, of stealing their purse, of just trying to prove that they're crazy. I'm in cahoots with the doctor. I want to steal their car. I've been accused of pretty much murdering and pilfering and burning everything down. Please, you can't take it to heart. Some of the things that you might be accused of and badmouthed about will break your heart. When you look at that person who's saying that to you, look at them as a person suffering with this disease. It's the disease talking. When they're bad mouthing, think about what kind of feelings could make them want to say that. Could it be fear or anxiety because they're not sure of what the future holds? They're not sure of what the next step is. They're not sure what the doctor's really doing. Also realize that The person they tend to badmouth is the person they trust the most. They feel secure. They know you're not going to leave them. And I know right now that's not helping much because you really do want to run away. But please, when you hear these awful, hurtful words, realize it's not them making up stories. You're going to hear some users. I've had, I had a woman who told me she had had a double mastectomy as I was dressing her. She didn't have a double mastectomy. I had a gentleman who won the Olympics in shot put. You're going to hear some amazing stories that make no sense at all. Just smile. Because in this moment, they did that. And they're proud of themselves. You know, he won the gold medal in the shot put. So I just asked him about where the Olympics were that year. Is it a real gold medal or are they fake? You know, like painted gold. Asked him all about it and just let him tell me about it. Because if I went and told him, no, you didn't. Nope. What is that going to accomplish? It's going to upset him. It's going to make us not have the best day possible. And it's going to end up making my day harder too. So I just kind of go with the flow and see where the story takes us. Resisting care. This is a challenge that we face almost every single day when it comes to caring for someone living with dementia. It's hard for them to have help from someone else. To have your child assist you in the bathroom. To have a complete stranger in the shower with you. This is not normal. Not for anyone. To have our child, who we've spent our whole life telling them what to do, now we're telling us what to do and acting like they're our boss. Who are they to be telling me what to do? I changed their diapers. It's very scary to realize that you need someone else's help. You've been this strong, independent person your whole life, and now you need to depend on someone else for basic things because you can't remember where you put your toothpaste. So taking that step back and that deep breath when someone's resisting care and looking at the big picture. What's going on around them at that moment? Maybe they're resisting going to the bathroom with you. So we rephrase it. I would really love to take you out to lunch today, Mom. Can we go in the bathroom and try on that new outfit I got you? And then when you're in the bathroom, that toilet is the safest and easiest place to sit down on. Because let's face it, in the bathroom, it's not like we have a whole living room set of furniture. So just have a seat there, Mom. And now we're on the toilet. We're getting undressed. We might as well pee before we leave the house. So instead of saying you need to go to the bathroom, you haven't been to the bathroom in 2 hours, and your Depends is going to be wet, you're going to get a UTI. Let's pass over that and turn it into something more pleasant and for a purpose, for a reason. Next, we're going to talk about mixing up our days and our nights and when we should be sleeping and when we should be awake. By the time we're in the mid stage of our journey through this dementia, the part of our brain that controls our REM sleep is damaged. So that internal clock that tells us it's bedtime, go to sleep, or it's daytime, be awake, isn't getting the message. It's also harder for us to get that deep down restful sleep that really recharges our batteries. So we tire faster during the day. This is very common in the late afternoons. It's called sundowning effect. We have been up all day. We have been doing everything everyone tells us to do, no matter if we want to or not. And now it's later in the day, and we're just tired, and we're grumpy, and we're sick of everybody telling us, do this, do that, get ready to go to bed, have you eaten your dinner, here's your pills. We're done with it. If you find that your loved one is getting that agitated in the late afternoon, early evenings, one of the first things I suggest to my families is a quiet time after lunch. I'll put on a quiet movie. We'll sit in the recliners, put our feet up, and just kind of take a little snooze. Be amazed at how beneficial just a 1 hour nap is. I'd like to now talk about some common health issues that may arise as we're progressing through the disease. One thing is feeling sick. They may be sick to their stomach. They may be tired. They may be lethargic. They may say their bones are hurting. They don't want to get up out of bed. This is very common. It's kind of twofold. One is looking at medication. So when your loved one is talking about not feeling well, the first thing I recommend is looking at their medications. Some medications that are prescribed to people living with dementia can cause nausea, diarrhea, unsteady gait, constipation, and sleep problems. Wonderful, right? So looking at those. Another can be what kind of call apathy, this flat affect. And it's very common with some dementia, especially ones that involve your cardiovascular system. And in that case, they're going to need to be encouraged to get up. Let's just move around a little bit. You'll feel better once you get moving. Come on, the doctor wants you to walk out. I have a few people like this that don't even want to leave their room to eat. And we tell them, you can't eat in your room. The doctor said you have to come to the dining room, and the nurse is there to give you your medication. So getting them up, getting them to the dining room, once I get them there, they'll participate in the rest of the day. But it's almost like you have to force them to get the juices flowing. And then once you do, they're good. Okay. The next one is falls and injuries. This is very common with dementia. As we progress through this disease, we're going to lose a lot of our peripheral vision and our depth perception, which is going to give us vision issues, and we're going to fall. Also, we start having problems with our equilibrium. And the doctors will prescribe walkers, which are wonderful. Except for if we weren't using the walker before we got diagnosed with dementia, we're most likely not going to be using it after we get diagnosed with dementia. You as their caregiver is going to spend more time chasing them with their walker than they are actually going to be using it. Just to let you know. Infections and pneumonias. Our brain doesn't just control our memory. Our brain controls every part of our body, including the part of our body that fights illness. As we progress, we have a harder time protecting ourselves from getting sick. We're more susceptible to infections such as urinary tract infections, sinus infections, skin infections, eye infections. We're also more susceptible to respiratory illnesses such as pneumonia. And because our brain is shutting down, we may not even run a fever. Because that's one of the first defenses our body does when we have an infection is we run a fever. We may not run a fever. So as a caregiver with them, we need to see the other symptoms and signs. And if you're concerned at all that you think something's not quite right, contact your doctor because they may not ever run a fever. And in the case of like a UTI, your loved one may never realize that it burns when they pee. Okay, so if you're concerned at all, contact your doctor about that and do some follow-up tests. As they progress through this disease, it's going to come to a stage where they're not eating and they're not drinking. And no matter how much you encourage them, they won't. And it's going to be harder for you to accept that than for them. Our brain controls our hunger and our thirst. And when that part of our brain dies, we're not hungry. We're not thirsty. We still have taste buds. So we can often be encouraged to eat sweet things. So encouraging those fortified shakes and yogurts and ice cream. We can get some extra calories that way. But we have to realize that our brain is dying, which means our body is dying. So as this issue of eating comes up and you start facing this challenge, don't do it alone. There's many organizations that can help you through this. Nationally, there's the Alzheimer's Association, which has a website and a 24-hour hotline. Reach out to your doctor, local support groups, depending on your beliefs, your clergyman, a local hospice. They can all give you some guidance and support through this. You're doing a great job. I'm sure no one has told you that today, but I'm telling you, you're doing great. Just hold on. Like they said, hold on, it's going to be a bumpy ride. Hold on. You can do this. Thank you for watching. This is Maggie. I'll see you soon.